Hello, this is Dr. Brett Titensor, and I look forward to sharing this episode of Case Bites with you as I go over Kim's lower implant bridge. Absolutely love this patient and excited to show you how digital dentistry really has changed this patient's life, taking her from a removable partial that she hated to a permanent implant bridge that she loved. I practice just north of the DFW airport in a town called Flower Mound, Texas. We're basically an all-digital dental practice. You will not see any alginate impressions here. We have 2 intraoral scanners, cone beam CT, in-house manufacturing with mills and 3D printing. I couldn't practice the dentistry that I do without it. So let me go into Kim's lower implant bridge. She had lost her lower teeth years ago, and she had been wearing a partial that she absolutely hated. In fact, one of the tooth had come out on it. She was wondering what are my options to get something permanent there in that lower front teeth. She didn't mind anything else. She just wanted something permanent. So you can see with the partial out, we've had some significant bone loss. This can be kind of a tricky situation, difficult case, but luckily we have digital dentistry that really helped me treat a case like this. And let me go over what we did. So we always start off with a 3D scan, a cone beam CT, so we can look at her bone. We take an intraoral scan, so I can even plan out where some final teeth could possibly go and look if she's a candidate for implants. And it's a tight spot, but sure enough, it looks like we can get 2 lower implants in for an implant bridge. So from our implant plan, we manufactured and 3D printed a surgical guide. All this was done just in our office, made right here. And then day of surgery, we used the fully guided kit. Now, this is super important. I love this kit. One, it's keyless. If you've ever done a guided surgery where you have multiple handles and sleeves and it can be difficult to manage, this kit solves that. It comes with the sleeve is on the drill itself. And another key thing is I can actually place the implant through the guide as well. So sometimes some kits will have it to where you do the osteotomies guided, but then you have to take the surgical guide off and place the implant freehand, which kind of to me eliminates the purpose, especially in a tight situation like Kim. So I just absolutely love this system. All right, so here is day of surgery. We tried on our surgical guide. What I love about these surgical guides, I can personally place the inspection windows exactly where I want them. And so I can ensure that this guide is fully seated. What good is a guide if it's not fully seated or not accurate, right? I just love these. They're stable. They fit great. We went ahead and flapped the tissue back, just kind of a mini flap. Use some sutures to keep the tissue out of the way while we do those initial osteotomies. You can use something like these guided pins to make sure that your direction is okay. I'll be honest, the guided surgery, we've gotten it down so well that only on rare occasions do I feel the need to even use these, because these the implant guides are so accurate. So we do our osteotomies, and here's some pictures showing you how we are doing the drills, and then also placing the implant through the guide itself. So here are the implants placed. In this instance, she had some pretty thin bone towards the top. So we buried the implants just a few millimeters into the bone. And sometimes when you do that, though, it makes it crowded to where your restorative parts don't have enough room to seat on the implants. And so that's why it's really important to have a kit like this. It's called a bone reamer kit, because you can try to, and I've done it, and it's one of the scariest things, is try to remove that bone with a diamond burr and trying to be careful without nicking your implant or something like that. This takes that guesswork out of it and that stress that can come from possibly nicking an implant. You basically screw on the channel on here on that left side, and then it just guides the drill and it removes some of that bone to give you room for the restorative parts. So we went ahead and did the bone reaming, got everything, got it some good space to where we could fit some nice healing caps over the top. And then we sutured. And here is that PA with the implants placed. And you always want to know, was it accurate? Was the guide accurate? So here was our plan. Here was our guide. And then here is the placement. So back and forth, you can just see just how accurate digital dentistry has made the implant dentistry. So after a period of about 3 months, after they're osseointegrated, we brought her back for a digital scan. These are scan bodies. We made custom abutments for her permanent implant bridge. And now Kim is super happy. She's able to have the confidence from not having anything removable. She's able to eat again, and all thanks to the power of digital dentistry. And thank you very much for the time that I shared. Follow me on Instagram, message me if you have any questions, and I look forward to sharing the next episode of Case Bites with you. Thank you.